Welcome back to Inside South Florida. I'm Dave Aizer.
And I'm Melissa Marrero. August is National Hair Loss Awareness Month, and here with the latest and greatest options for men and women is Dr. Alan Bauman.
Dr. Bauman, good to see you. Welcome to our show.
Hey, thanks for having me, Dave.
It's my pleasure. Let's get right to it. Let's talk about the various stages here of treatment. We'll start with the least invasive and talk us through it.
Sure. So most people will start with something like nutritionals or hair care to try to manage what's going on with their thinning hair problem. Unfortunately, we have to get a little bit more on top of the problem. The evaluations that we do in the office can actually measure density and hair diameter. We have hair cameras, microscopic magnification to see exactly what's going on with the density, so we know to take action. And what can we do? We can start with prescription products, medications that we prescribe either topically or orally. We can use at-home laser therapy devices like the Capillus Laser Cap.
Yeah, this thing looks wild. Tell me about this.
Yeah, so Laser Cap is a brand new device. It's 6 minutes per day at home, drug-free, chemical-free, zero side effects with excellent hair regrowth. So it's not going to regrow a dead follicle, but it'll enhance the hair follicles that you have.
Okay, I'm glad you said that because I want to make sure I understand that, our viewers understand that too. At what point do you have to do the surgery? Do you have to do the transplantation? Nothing else is going to work. When do we reach that point?
So the medical therapies like topical medications, oral medications, laser light, even PRP, platelet-rich plasma that we do in the office, that's to protect the hair follicles that you have and enhance those. But if the follicles are dead and gone, you're going to need some kind of hair transplant.
So you're able to look at a follicle and determine if it's still alive?
Well, when we look at the scalp, we can see, are the follicles miniaturized beyond repair or are they missing or gone? And that's how we're going to know. Like a receding hairline, for example, those areas are going to be beyond repair with just non-invasive treatments. So we're going to have to hair transplant that. Like smart graft, like FUE technology, minimally invasive that leaves no scarring, no scalpel incision, no stitches or staples. We move the individual follicles one at a time from the back of the scalp into the thinning or the balding area.
That is wild. How long does that take?
So it could take a long time. I mean, a procedure could take 6 to 7 hours in the practice to restore a good-looking hairline.
And the person's awake?
Person's awake, but comfortable, watching movies. They can get up and go to the restroom. We're going to feed them some snacks, but there's not going to be any discomfort there. It's all under local anesthetic.
So what's the sort of the most dramatic thing that you've seen or done? Like, in other words, how bald was somebody before they saw you? I know there's some great before and after photos, and then after they left, they look like George Clooney.
Sure, so our typical patients are more like some of the before and afters that we sent over to you, like Brian, who had his smart graft procedure with us. But my dad was totally bald before we transplanted him. So he needed 3 separate procedures to restore what looks like a full head of hair today.
That's amazing.
Yeah.
Because I was under the impression that if you were fully bald or mostly bald, if you had the George Costanza thing going on, there was no hope for you.
No, that's not the case at all. Most people have enough hair around the sides and the back of their scalp to redistribute. Those are the permanent hair follicles. So we're going to put those into the hairline, the frontal density, and recreate the coverage in the crown.
And how long does it take before you're able to sort of walk confidently out in the streets and feel good?
Yeah, so great question. Recovery is going to be super comfortable. It's going to take about a week for the crusts to flake off of the scalp, and then you're back to normal. Maybe with a little shorter haircut, but you're going to be fine. Then the hairs shut down and they start to kick in and grow at about 6 to 12 weeks. So it's going to take about 6 months to see half of the result and the full result in a year.
It's not bad at all.
Not bad,
Yeah.
and it's there permanent, so you never have to worry about it. The transplanted hair does not need any further treatment. It's there forever.
Okay, well, this sounds great. If people want to reach out to you, how do they find you?
So they can call, click, or visit baumanmedical.com.
Great to see you, my friend. And this guy's hair is so good, you have to trust him. Look at this head of hair. So he did a hair exam on me. I'm good. However, there's a little bit of miniaturization.
Sure, you're good. It's because you like push your hair forward. So
I'm doing the push. No, I'm good. As far as I'm good.
Okay.
For now.
All right.
Hey there, it's Dr. Alan Bauman. Don't forget, you can start your hair loss consultation from anywhere in the world by visiting baumanmedical.com.